How do doctors diagnose ADEM versus MIS? When doctors try to figure out if someone has acute disseminated encephalomyelitis or multiple sclerosis, they look at a few key clues. First, they examine how the symptoms started. ADEM usually begins suddenly after an infection or vaccination, with a rapid onset of multiple neurological problems and often altered mental state, like confusion or drowsiness. This mental change, called encephalopathy, is common in ADEM but rare at the start of MIS. MIS, on the other hand, tends to develop gradually or with episodes separated by time, often without significant mental changes. Instead, MIS symptoms come and go, affecting different parts of the nervous system in episodes called relapses. Next, they use magnetic resonance imaging, or MRI, to look at the brain and spinal cord. In ADEM, MRI shows large, widespread lesions that are often bilateral and asymmetric, mainly in white matter but sometimes involving deep gray matter like the thalamus or basal ganglia. These lesions tend to appear all at once during the initial episode and usually stay stable or resolve over time. In contrast, MIS lesions are smaller, often located around the ventricles in the brain, and may show a pattern called black holes, which are areas of permanent tissue damage. MIS lesions tend to accumulate and change over time, with new lesions appearing on follow-up MRIs, indicating ongoing disease activity. Doctors also analyze cerebrospinal fluid, or CSF, which is the fluid surrounding the brain and spinal cord. In ADEM, CSF often shows increased white blood cells and higher protein levels, reflecting inflammation. Oligoclonal bands, which are specific antibodies indicating chronic immune activity, are less common but can sometimes be present. In MIS, oligoclonal bands are found in most patients and are a key sign of long-term immune activation within the central nervous system. The IgG index, another marker, may be elevated in MIS but is less consistent in ADEM. Blood tests for myelin oligodendrocyte glycoprotein antibodies are also helpful. These antibodies are more frequently found in ADEM and can help distinguish it from MIS, as they are rarely seen in MIS. The overall disease course provides additional clues. ADEM is usually a one-time event, called monophasic, meaning it happens once and then the person recovers. MIS, however, involves multiple episodes or relapses over time, with new symptoms and MRI lesions appearing months or years apart. If a person has a second attack or new MRI lesions after 3 months from the first episode, doctors become more confident in diagnosing MIS. Because the symptoms of ADEM and MIS can look similar, especially in children, doctors relying on this combination of clinical history, MRI patterns, CSF analysis, antibody testing, and follow-up over time. This comprehensive approach helps ensure an accurate diagnosis, guiding the right treatment plan. Remember, each person's experience can be different, so ongoing medical evaluation is essential. Always consult healthcare professionals for personalized advice and diagnosis.